You take another one of the human capital, another sector of the human capital development is health. When we came in as a government, our budgetary allocation to the health sector was 6%. In 2019, we moved that from 6% to 8%. Today, we are at 11.7%. Although people will say we are still short, because the Abuja Declaration says every sub-Saharan African country has to spend about 15% of its GDP on health. But with 11.7, comparatively, we are one of the biggest spender in the health sector in Africa. Just like in education today, in the income category, we are topping. In the income category that Leone finds itself, we are one of the biggest spender in education. We are one of the biggest spender in health. What has 11.7% given us? When we came in, we realized that the hospital system has virtually collapsed. There was lack of specialization, very limited teachers, the whole healthcare system, the whole healthcare sector, from primary healthcare to secondary healthcare centers to tertiary hospitals, we are marred by lack of human resources, by lack of material resources. And then as a result of that, we needed to reverse that decline. Infant and maternal mortality was at the highest. At that time, by 2018, we were at 1,117 deaths per 100,000 life birth. 2-3 years down the line, we reduced that to 717 by maternal death by 100,000 life birth. Just a couple of weeks ago, the last analysis that came out by the World Health Organization, we reduced that further to 443. And just 2 days ago, the WHO representative in Sierra Leone went to His Excellency to congratulate Sierra Leone that we came first in the last 2 years, the rate at which we reduced maternal and infant death from 717 to 443 within a space of 2 years. No country have seen that kind of dramatic reduction. So we are satisfied with that. Today, we are confident that our sisters, our mothers, our relatives, they can go to deliver and they'll be able to deliver safely. We have done that. We have recruited over 6,000 healthcare workers. 6,000 healthcare workers in this country. We have improved the rehabilitation of hospital system. For the first time in Sierra Leone, the free healthcare program. Before, when we came in 2018, government subvention to the free healthcare program was about minimal, less than 10%. Today, that free healthcare program, Sierra Leone, our counterpart funding to the free healthcare program has risen to nearly 40%. No government has been able to do that. We are doing that because we believe that is an investment that needs to be made. Today in Sierra Leone, I remember 2018 when we took over, when I visited the McKinney Government Hospital, and I asked the people there, there was only four baby care units in the provinces, only in district regional headquarter towns, in McKinney, in Kenema, in Bo, and in Port Loko. I asked the UNICEF. We came back to Freetown. We designed a program to see how we can push UNICEF and then how we can put additional funding so that we can expand baby care unit across every district. Today in Sierra Leone, premature baby born kids have 80% chance of survival. We turned the thing around. Before it was 20%. Now it is 80%. Every district hospital have got a baby care unit. We are very satisfied with the indicator. Today, when it comes to the ratio of number of nurses per Sierra Leonean citizen, we are above the sub-Saharan African average. Although when it comes to the ratio of doctors to patient, we are still below the sub-Saharan African average, but we have expanded postgraduate specialization courses. We are now turning out more doctors. The rate at which the Sierra Leone, the College of Medicine and Allied Health Sciences is turning out doctors is very low. So as a result of that, His Excellency have decided that we are going to build 4 big, what we call tertiary teaching hospitals across the country. We are going to start one with a funding that we have got, a $50 million funding from the Saudi government. We'll build the first one in Lungi. The other one will be built between Bo and Kenema, just around just Bob and Kenema, I forgot the town's name. And then we are going to position another one in the north. The whole idea why we want to do that is that we want to increase training for nurses. We want to increase specialization training so that government will spend less money by sending people outside for postgraduate specialization training. Also, because we have been doing very well with the health sector, you have traditional development partners. Before this time, they don't spend money on the health sector. One is World Bank. Just recently, last year, the World Bank gave us $60 million. For the first time, the World Bank is dedicating $60 million, not loan, nothing, it's a grant to supporting maternal and infant health. Because we decided to take the model of the Connaught Government Hospital. The Connaught Government Hospital is run by Partners in Health. Partners in Health is an American NGO that has been working in Connaught. In 2021, they registered 0 maternal and infant health in that hospital. So because we realized that we are doing very good, we have decided that that $60 million that we are going to implement in certain areas in Kailaun and Kenema and other districts, Partners in Health is going to move that. So the model we have in Connaught, we are going to replicate it across in those areas. We believe with the investment we are making, we will able to turn around the challenges in the health sector. The one fundamental challenges we had also was the issue of governance. Because, you know, the Minister of Health has been clouded over the years. You have doctors, clinical doctors that have abandoned the hospitals, that have abandoned their medical practices. They are all back in rebuilding, trying to manage projects. That has created a serious human resource deficit in the hospital. So we sat down and we realized that managing an hospital does not necessarily require a clinical knowledge. You are trained to be a gynecologist or a surgeon does not mean that you are going to manage, you are going to run an hospital. So what we did, we advocated for the establishment of the Directorate of Hospital Management for the first time, because we wanted to improve hospital management. We wanted to see that the 11.7% we are spending in health is reflected at the hospital level. So we started in Connaught and we have been improving hospital management. We still have challenges in certain areas because we still have challenges of trying to fight with the decentralized unit over the control of hospital. We have come to a conclusion that local councils cannot manage hospital because the local council's administration, they are not conditioned to an hospital management. An hospital management is a fiat management. It's a management system that is an emergency driven. You have to be in an emergency driven logic. And the councils are not in that logic. So gradually, we are going to take the hospitals out of the council, improve their management. Because even though we still do the free healthcare, even though we give supplies, it is sad to learn that in certain hospitals, when these supplies get in, within a space of 2-3 months, they are finished. So there is lack of proper management at certain hospitals. It depends on the individual, it depends on the DMO, that is the district medical officer, as per individual hospital. That we have been doing. But the key is that we now know as a country that the 2030 target, that is the SDG target, to provide free, affordable healthcare for every Sierra Leonean by 2030, it is a challenge. We know we have made some investment. So we decided also as a government that we are not only going to approach UHC, that is universal healthcare coverage, just on one track, that is the free healthcare delivery. We decided to add another track, that is the health insurance scheme, so that people in the formal sector, people in the informal sector can also benefit from healthcare coverage. We are working on that. I have personally visited Senegal with the Minister of Health, because in my office, I have a health unit to advise me on what we do in the health sector. We visited Senegal. We are in the process of finalizing the act. Well, once we finalize that act, then we know that we have a 2-track approach to achieving universal healthcare by 2030. Although that is a very ambitious, we know that there are still challenges, but yet still we have a clear vision of how we want it to go. We have a very good Minister of Health. We have a very good Minister of Education. They have been doing excellently very well. The other area I will touch on, which, you know, our chairman touched on also, is the area of agriculture. That is